Hello everyone, welcome back to my channel. In this video, I am going to talk in detail about diagnostic algorithm of polyuria and polydipsia in order to confirm whether a patient has polyuria or polydipsia is by measuring their specific gravity and water intake. A specific gravity is usually low in case of polyuria because the urine is excessively diluted. So, in dogs, if the specific gravity is less than 1.030 and in cats if it is less than 1.045, then it can be considered as low specific gravity due to polyuria. Similarly, water intake. A normal dog or cat can drink water up to 100 ml per kg per day. If that amount exceeds, then it is considered as polydipsia. Polyuria should also be reconfirmed once again by collecting 24-hour urine sample from the same patient, and we need to check the specific gravity from the same patient. If it is still low, then it confirms that the patient has polyuria. And also, how to confirm 24-hour urine sample? Either we can fix a catheter, urinary catheter, and collect the urine in a bag, or we can put the animal in a metabolic cage so that we can monitor 24 hours urine sample. Okay. Similarly, water intake should be solely measured only by the owner at home, because dogs and cats tend to get very stressed when they are at veterinary hospital. So it is always better for the owner to monitor at home for a period of 12 to 24 hours. Once you have confirmed that the patient has polyuria and polydipsia, the second thing we need to do is rule out underlying conditions that can cause polyuria polydipsia. So the conditions such as diabetes mellitus, renal failure, Cushing's, feline hyperthyroidism, hypercalcemia, and liver disease. These are the things that can cause polydipsia. Once the patient doesn't have all these things, then we need to rule out drug and diet history. Drugs such as glucocorticoids and diuretics are known to cause POPD. Aminoglycosides and phenobarbital like anti-epileptic drugs can also cause POPD. Diet such as high salt diet can increase thirst, and low protein diet can also cause polyuria and polydipsia. Some thyroid supplements, like if the thyroid supplements are excessive, that can also cause POPD. Once you have done all these three things, then comes physical examination. In physical examination, you will be checking the animal thoroughly and you will have various findings. According to the findings, the algorithm varies. For example, if your patient is an old cat or the cat that has thyroid mass, the first thing you need to suspect is hyperthyroidism, because it is very common in cats. Okay, so to confirm hyperthyroidism, what will you do? You will do a lab work, which is by estimating T4 levels. If the T4 levels are going to be high, then it indicates that hyperthyroidism is the cause of POPD. Secondly, if a dog is intact female and it is of middle to old age and it has a recent history of estrus or abnormal vaginal discharge, then the first thing you need to rule out is pyometra. What will you do to rule out pyometra? You will go for abdomen imaging. If the abdomen imaging shows the signs of pyometra, then the cause of POPD is confirmed. Similarly, if a dog, middle-aged to old dog, that comes to your clinic with pendulous abdomen, truncal alopecia, skin thinning, all those signs, so the first thing you need to suspect is Cushing's. How do you confirm Cushing's? Again, you will do low dose dexamethasone suppression test followed by ACTH stimulation test. Okay. Then, if on physical examination, this applies for cats, because cats' kidneys can be easily examined by the palpation itself. So, if the kidneys are small, that's not normal, right? They can have renal failure. So, you might have to do some further blood work to confirm if the cat has renal failure or not. Similarly, if our patient has fever or painful kidneys, then the first thing you need to do is check urine sediment for inflammatory sediments. If the sediment is of inflammatory origin, like pus cells, all the bacteria and all, so the first thing you need to suspect is pyelonephritis, and you might proceed with culture and sensitivity. If it is of non-inflammatory sediment, again you might have to do further lab work to rule out other possible causes. Similarly, if our patient has cataract, the first thing you need to think of is diabetes mellitus, because diabetes mellitus directly correlates with cataract. And then you will proceed with lab work by estimating random or fasting blood glucose levels, urine glucose levels, etc. And on physical examination, if you notice enlarged lymph nodes, what will you do? First, you will do a aspirate and send it to the lab, and the cytologist will confirm whether it is lymphoma or not. If it is lymphoma, you have your diagnosis. If it is not lymphoma, if you are having non-specific changes, then you need to do further investigation at lab. Similarly, if your patient has bradycardia, generalized weakness, GI signs, always suspect Addison disease, and also your patient should be old. Okay. And if it is Addison's disease, again you will do ACTH stimulation test to confirm. Okay, I have explained everything. Now from the lab work, let's see what are the different findings we will get and how to correlate that findings with the causes of PUPD. First thing, CBC. In CBC, if you see inflammatory leukogram with left shift, which means it is not normal, it is having some infection or inflammation going on. Okay, if you do that, two things you need to do. One, you go for urine analysis. Okay, in urine analysis you will do urine sediment also, and the second thing you need to do is abdomen imaging. In abdomen imaging, you will be able to diagnose pyometra, and you will also be able to diagnose hepatomegaly. Pyelonephritis can also be diagnosed easily. And the second thing you need to do is urine analysis. In urine analysis, we will be measuring urine glucose. If the urine contains glucose, and you need to check the serum simultaneously. If the serum also contains glucose, then it means diabetes mellitus, you have your diagnosis. If the urine contains glucose but the serum is normoglycemic, then it is renal glycosuria, you have your diagnosis. Then if the urine is isosthenuric and the patient has azotemia, then it confirms renal failure. In order to confirm renal failure, like you will also do other tests like BUN, creatinine, phosphorus, etc. You will, and UPC ratio also in the urine to confirm it. So you will have your diagnosis. Now in urine sediment, you will see casts and crystals and all the things, etc. So if the sediment is of inflammatory origin, if it has pus cells, bacteria in it, then it can indicate pyelonephritis. To confirm it, you will proceed with culture. Okay, if the culture is positive, you have your diagnosis already. If the culture is negative, we have to further investigate. Okay, and similarly, In urine sediment, if it is of non-inflammatory sediment, then your lab work, you need to further investigate why this is happening, and you need to find the differential diagnosis that correlates with the clinical signs, which is PUPD. Okay, now I have covered urine sediment, abdomen imaging. Now let's talk about electrolytes. In electrolytes, if the electrolytes are normal, that's okay. If the electrolytes are abnormal, which is like sodium potassium ratio is less than 27, and you also have hypokalemia and all, then you need to do ACTH to find out whether we have Addison's or Cushing's. If you know, if one of them gets confirmed, then you will have a diagnosis. If everything comes normal, if ACTH stimulation test is also normal, then you need to proceed with urine culture. Okay, and in abdomen imaging, if the changes are non-specific, then you need to proceed with measuring the water intake. By measuring the water intake, you will know whether the patient has actual polydipsia or not. Okay, for dogs that has that is more than 8 years and that has polydipsia, then you need to proceed with urine culture. Dogs that are less than 8 years with polydipsia, then you need to proceed with ACTH stimulation test and you will get the results. If it is a cat that is more than 8 years old, then the first thing you need to do is measure T4 levels. If the T4 levels are elevated, then it is hyperthyroidism. If the T4 levels are normal, then again you need to proceed with urine culture. Coming to other serum analytes, liver enzymes, bilirubin, albumin, low albumin, etc., low BUN, etc. If all these things are there, then it correlates with underlying liver pathology. So to confirm it, you need to do serum bile acid assay. You can do fasting and postprandial bile acids. If the results are abnormal, then it correlates with liver disease. You have your diagnosis. Okay, if it is normal, please proceed with urine culture. So everything stops in urine culture. And also one more thing I forgot, in lab work, if you have hypercalcemia, you have a separate algorithm for hypercalcemia, which I am not going to talk right now, but there is one important point you need to know. If it is hypercalcemia, you need to measure ionized calcium levels. Okay, ionized calcium levels are the true indicators, and if the ionized calcium levels are high, then it can correlate to some neoplastic condition and all the things which I will discuss later. But let's come back to the urine culture. In urine culture, if it is positive, then you have your diagnosis as UTI or some bacterial cystitis and all the other things, because they can also cause polyuria polydipsia. If it is negative, then what you have to do is you need to proceed with modified water deprivation test, which means you are going to withdraw water from your pet, which should normally concentrate the urine. If the urine gets concentrated, then you have your diagnosis as primary psychogenic polydipsia. If the urine does not concentrate, then you need to proceed with ADH challenge test, which is antidiuretic hormone challenge test. You are administering synthetic antidiuretic hormone to your pet, and you are going to observe the urine to concentrate. You are going to check the specific gravity. If the urine is going to concentrate, if the urine is concentrating, then you have the diagnosis as central diabetes insipidus. If the urine still does not concentrate, then it indicates that our patient has nephrogenic diabetes mellitus. So this is how you need to approach the cases of polyuria polydipsia. And I also have some important points to tell you. 40 to 50% of Cushing dogs always have concurrent urinary tract infection, so their culture is going to come positive. And in Cushing's, what are the hallmark signs of Cushing's are elevated liver enzymes, stress leukogram, hypercholesterolemia. The serum will all mostly be lipemic, okay? And then bacteriuria is also common in Cushing's. Then coming to renal failure, in conditions such as renal failure with hypercalcemic nephropathy, PUPD is very common, okay? Then in Addison's disease, sodium potassium ratio will be either less or equal to 27:1, where there will be hyponatremia and hypokalemia. And in patients that have PUPD, if there is concurrent azotemia, then you need to do GFR test and creatinine clearance test to further confirm what is wrong with them. If the PUPD is with non-azotemia, if the patient has no azotemia with PUPD, then you need to do water deprivation test and ADH response test to further diagnose. And in case of hypercalcemia, you need to check ionized calcium and parathormone. If there is high ionized calcium, or it automatically correlates with underlying neoplastic condition, or it can also mean that the patient has hyperparathyroidism. If the ionized calcium is low, then it can say that the patient can have primary renal failure, or it can have hypoadrenocorticism. So that's all for today's video. I hope this video was informative. Thank you so much for watching this video. If you liked it, please subscribe to my channel for more such videos. I'll see you all in another video. Till then, take care and bye.